Okay, it is now 9 a.m. We will call to order the Public Health Committee meeting of Wednesday, July 22nd. Clerk, please call the roll.
Silva, Allen, Kenyon, Sanchez,
Here.
Thomas,
No, Monica Silva is online. I think she just unmuted.
Silva here.
thank you.
Thank you, Roger. Silva is here.
Thomas, Weber,
Present.
Lewis.
Here. Okay, thank you very much. So next is approval of the minutes, and they are not prepared, so we're going to do that next month. Finance is next. And so there's nobody here representing finance, as has been the case. So is there any question on any of the reports? Okay, we'll move right along. We have a pretty full agenda this morning, so this is good. There is no public comments. So going right along to the Executive Director's report.
Good morning. Good morning,
Morning.
Chairman. Roger, can you move the slide to our flash report? Yeah, thank you. So I want to bring your attention to our flash report. As usual, sorry about that. As usual, we highlight our essential services, and one of the essential services we're highlighting is looking at our Medical Reserve Corps, who help supplement our workforce. We've had in excess of 60 Medical Reserve Corps sign up since this COVID-19 because of the impact of what we're having. We really didn't have enough workforce to do the work, and I will say they have been just overwhelmingly supportive and jumping in and doing lots of roles to help us, contact tracing, answering phones, running errands. One of the things we do when we find seniors who are within their homes in isolation or quarantine, they take them their food and things like that. So the MRC volunteers have just been exemplary. So one of the things we do, because they're doing it as volunteers, tomorrow we're having a virtual recognition, so that should be interesting. Usually we try to have an annual recognition of them, and so we will be doing it virtually tomorrow. But I can't say enough about the importance of our community coming together in a volunteer capacity. We vet each one of them. A lot of them are volunteer healthcare, retired healthcare workers in various capacities. Others are not. And so there's room for everyone in terms of the medical reserve, whether it's data entry, answering phones. In the past, they've even helped us with, we had a lead research program where they went out and helped the community collect water to have their lead tested in their homes, in their water system. So I can't thank our Medical Reserve Corps enough about all the work that they have done. I mean, they showed up in force to support us in this effort, knowing that we didn't have capacity. So that's how we look at encouraging a good public health workforce, and kudos to the Medical Reserve Corps. And the second item I want to bring you to is giving people the information they need in making healthy choices. I just want to remind people, I know we're all being very cautious and social distancing and staying, going to just essential places. And one of the places that have opened up, thankfully, is the farmer's market. And so it's really important that we eat healthy foods during this time. I know I'm guilty of that. It's easy to eat a lot of processed foods because you want to shelter in place and you had things delivered. But I encourage all of us to really look at our diets to stay healthy. That keeps us healthy and safe as well, so you don't have additional healthcare problems. So our farmers markets are out. They have an abundance of wonderful fruit and produce. And so again, it's about our economy as well. These are people who are gardening, and some of this is the way they support their income. So I encourage our community to, one, eat healthy and go out and support our farmers markets, because it's important that we continue to stay healthy, and it's at a bargain price. So that's my flash report for today.
I have a real quick question.
Sure.
You said you're doing a virtual recognition tomorrow.
Yes,
Is that open to board members that might want to? Or is it?
it can be.
Okay.
It can be. I'll send you the link. I'll send you the
Okay.
link. None of that. Well, you can have it on your desk.
Good morning. Hey, I wasn't sure what time
We
Kim
get
was coming.
virtual ice cream.
Oh, okay. That was,
I will make sure when I get back to the office, I send that link to everybody.
That'd be just good. Thank you.
Thank you for asking.
You want to do resolutions or the presentation?
Oh, I'm sorry. I'd like to do the presentation. So before we get started, I sent you, hopefully you saw it ahead of time. If not, I'd like Roger to put a link to a contact tracing. This YouTube, and it's a little over a minute, it gives a great description of how contact tracing works without a lot of words. And it really gives a good pictorial of what we're going to be doing and the impact of it. So Roger, if you would do the YouTube. So I just wanted to give you a really quick overview of how contact tracing will work. Now I'd like to talk about contact tracing on a more technical level around what we're going to do in Kane County and the impact it has on our community. So next slide. So why are we contact tracing? Primarily to save lives, reduce the spread of the virus, and increase our economic impact. Next slide. Contact tracing is an effective tool, as you saw in the video. Behavior change is more likely when someone is contacted directly by public health than public health authority and told they are specifically are a contact to a confirmed case. And we've talked to lots of people, and when you are really frightened and don't know what the disease, what happens is you get a call and you are told what to do. So one, it minimizes your fear. Two, it gives you good information about why you should stay home in quarantine during which periods of time, because a lot of people, especially if they're asymptomatic, think, oh, I'll get back out there because I'm feeling great. But you get the information of the importance of what we should do. So while everyone should be social distancing, we know that the details vary widely in how different people view this and implement social distancing. As you have seen in the community, some people, I have seen them walking up and down the street and they'll cross you in the aisle and they don't have a mask on. So it's really important that we educate our community the importance of contact tracing. The next slide is a graph that I want to show you. Again, I'm just focusing on King County. So what I'd like you to look at on this chart is the case count by week. So when we first started charting this in week 1, we're calling it is March 16th to March 22nd. The bars indicate, the blue bars indicate how many cases we had during that week. The orange line that goes through and the number attached to it is the number of deaths reported during that week. So if you see week 1, we had 0 deaths, but if we go to week 9, we were up to 45 deaths. And then let's look how we are tapering off in cases, but our death rate went up, so we're going up and down. And as of week 18, 713 to 719, we're down to 2 deaths. We celebrated in, when we have lower deaths, but again, this disease, we want no death. And you can see our numbers around the cases. So this is important so you can see the trend and the analysis. And this gives us an indication of where we're going and what we need to do around mitigation, containment, and control. So some of the requirements from the Illinois Department of Public Health requires us to put 30 contact traces per 100,000. As you saw in the video, every single person has to be contacted. And when they showed the video, when that second person is going to be contacted too, because we got to stop you from going out as well. Well, with just, we have about 20 contact traces. If we had when we had 1,400 cases, we don't have capacity to do that. So that's why the state came out with a formula for all health departments, 30, they're recommending 30 traces per 100,000, which gives us approximately 160. ASTO is another public health entity for state and local territorial health departments. They even have a list higher. If we went with their formula, they think we should be up to 240. But we're going to go with, our governing entity is Illinois Department of Public Health, so we're going to go with that metric. One of the things the Illinois Department of Public Health has done so that we have a platform that's sustainable later is we all required to use a platform called Salesforce, and they've hired Slalom to teach us all. So that is the platform we will all be using, and we will have it afterwards. That's the nice part. And so when the tracers are trained, they'll go into this platform, they'll pretty much, I'll give you a high level link into the state's database, pull the positive cases, and then the contact tracers will be trained on Salesforce. So it works like this. Positive cases they come in and you have to contact them within 24 hours. The problem that I see with this, if we don't get our testing results back quick enough, because if your tests come back in 14 days, kind of like a moot point. So we're hoping that our capacity for returning on the test increase. So if your test comes back, let's say in 48 hours, and we call you and then you tell us all these places you've been, again, you've minimized the spread because those people will get contacted too, saying you've been potentially exposed and now these are the measures you have to put in place yourself. If we get you on day 7, now you're trying to remember where you've been and then who has been exposed. So that's why it's critical that we have a 24-hour turnaround once we get the positive cases. And one of the things, because this is a huge undertaking across the country, not just in Illinois, we really have to have regular reports of accountability to make sure everything is going the way it is. I had my orientation the other day, and it's about looking at, there's some measures that you have to look at, and you have to hit some metrics and determine what interventions need to be taken if we're not doing well. So our process for contact tracing, we've been working on this over 6 weeks because we knew this was coming. So you can't wait because of the scope and the size of this project. So we consulted with the Illinois Department of Public Health, looked at what our options were. All health departments have various options that you can do. We went with Kane County IT Department because of the technical infrastructure we need to have. We want it to be sustainable after this is over, because this is if we had a platform that we can keep later for all of our infectious disease, this would be great. So Roger and his team looked at our consultants and gave us some recommendations and advice of what we should be doing, what we should be looking for, the type of persons and platforms we should do. And then we talked to our peers to see what were they engaged in, because we have options to either do it yourself or to contract out. And I personally don't see where we can put 160 people, have the technology infrastructure and all the equipment that goes with it. So I chose to contract it out. So then we received presentations from 4 different companies. We selected KPMG, LLP, and TTEC, who will help us recruit and train and maintain those 160 people, and get us up and running according to our needs and meet our criteria of a 24-hour turnaround, hiring from our community, and some of the other elements that we really required going forward. And then we have been working probably last 3 weeks with the state's attorney's office to review and vet the contract, because again, this scope and size is way beyond my capacity and my staff. So we wanted to make sure we had all the legal things looked at, because this size and scope and cost is enormous. And I just wanted to make sure I had all the T's crossed and the I's dotted before we move forward. So here's the scope of work that we're looking at. The company's going to hire the majority of the contact tracers from Kane County. That was a requirement of mine. The Illinois Department of Public Health has put a website, I have at the end of this presentation up, so local individuals, if they want to apply for a contact tracing position, they can go online, and then they'll continue to recruit other places. But there's an opportunity for, and the link is on the health department's website if you're interested in that. They will train all of our tracers. They'll place contact tracing costs to residents within the 24 hours, as I indicated. They'll use state-selected Salesforce platform for contact tracing. Else we couldn't hire. If you didn't understand Salesforce, we couldn't use you, because again, that's going to be the long-term infrastructure platform. They have to assure privacy and confidentiality practices are followed with all the traces, because this is your health information that people are giving. We have to be scalable. If we have an outbreak, if they can't scale up very quickly, we can't use them again. We need that 24-hour turnaround. So we need them to scale up and scale back. Some of the companies looked at couldn't guarantee us that. So that's why, again, how we begin to select our vendor. They have to provide daily, weekly, and monthly performance reports. We don't want to wait 2 months later and find out, uh-oh, we're not hitting our mark. So and that's where Roger came in around telling us to have a person within our scope, a technical consultant that works for the health department, not the company, to say, wait a minute, this is not working, because again, this is out of our scope and reach of work. So we will be making sure that we understand the reports that we get and what's going on. And then not put the burden on Roger and his team, because this is a full-time job that he would have to really give us a person, and he doesn't have that capacity. It's a secure system access, and that was one of the other things. Roger helped us understand the security of the system because of the nature of what's happening. Monitor clusters in the community, and I'll talk a little more about that in the resurgence, but clusters of cases is really important to give you some valuable information to tell you what's going on in your community when you have clusters, and they'll be able to give us that. Provide medical, behavioral, and social resources for case and contacts. This is the wraparound services. So if we have you isolated and you live alone and you have no way of getting your medication and your food and taking your dog out, and you say, well, I have to go out and do those things. Well, now you're exposing others. So they'll get the resources for folks and say, you know, do you live alone, or do you have difficulties getting these things? And that's called the wraparound services. That's one of the things we need them to know, how to get to the wraparound services. Again, we want to keep you inside, isolated or quarantined during your infectious period time. Next slide. Oh, one before, Roger, I had two on. Yeah, go back one. Monitor cases of isolation during duration period. You know, people think that I'll just go out this one day because there's a party over there. So we want people to monitor them all the time to make sure you made your 10-day, your 19-day. How are you feeling? Checking in with them, because that's part of the work of contact tracing, to make sure you're not leaving prematurely to go to work, to go out to the store. So that's a really important piece that had to be incorporated in the scope of work. Create and implement data management platform that integrates into the health department's data from various data sources. It is important that we own all of this when this is over. And so if they're working with some foreign data that can't integrate, again, this is where Roger's team came into play, supporting us. If we can't have that when it's over and we know how to manage it, then, you know, it's one of those cans on the shelf, and that's not what we wanted. We wanted sustainable data management so that we can control it, and that's why we have to have a person teaching us along the way too. So that's part of our the scope. Provide project communication plans to ensure execution. We want to know all along the way what's happening. We don't want to know after the fact, well, these are the challenges we had. Again, status reports. Inform us of the impact of the schedule and the budget. Again, that's about the scalability of the project, what's happening. Meet regularly with our team to identify and resolve issues. And again, that's why we have to have a technical consultant for technology to help us understand what's going on, and then consult with IDPH on, so what's our next step if we have to deviate. Develop user manuals for successful implementation. They can't give us the platform and say, bye. If we don't have a manual, then we'll be paying them again to teach us again how to use the platform. So that was part of our scope of work. We have to have in our hands how to use the platform without depending on them. We have to be independent after this is over. This is our sustainability. Oversee systems operations during project transition periods, so they have to help us as we transition from them back to us, and then conduct post-project evaluation. So we really want to know, so after this is over, how did it go? What were the positive things that came out? What are some of the gaps that we saw? What can we improve on? So we really need to know that. So that's our scope of work. Now, how does contact tracing save lives? As I said, there were 3 things that it does. When we identify cases early, it reduces the spread of the virus, as you have seen in the video. It reduces severe illness requiring hospitalization. Why that is so important is because when COVID started and the hospitals were overrun with COVID-like cases, that it means other acute illnesses could not be addressed because you had those hospital beds. And then they found people were so fearful to go into the emergency room, they let their illnesses progress to a worse, so you could have gone in and just had a chest pain. Now you have a full-blown heart attack. So if you don't stop people from going out and spreading the virus, and now you're hospitalized, because in the beginning you were asymptomatic and you felt pretty good. And so we don't want our hospitals not to be able to treat other acute illnesses as well. And reducing the outbreak in congregate settings. I can't say this enough. This is where your cases explode. And when people get together in groups of people, sometimes they can't help it. So in our long-term care facilities, that's a congregate settings. You have a lot of people living together. So that's why it's really important to have infection control plans. Other places, such as manufacturing plants, people work in close proximity, so that's why the health department had to go out as well and help them. That's an infection control plan. They had good plans for maybe their food products, but not for the people. And then lastly, where we're seeing congregate settings, and I'll show you later on a slide, our other congregate settings where we go out to the bars and we're in close proximity, we're going to parties. I just read an article, it was an article, the state sent it out. I can't remember the community, it wasn't in Illinois, but they're seeing high cases in party buses. So people are getting back on those party buses, and so that's how you get clusters in people in congregate settings. And so the infection rate, because you think nobody sees you on this party bus and you're having a good time, and now you're testing positive, and think about it, you're right on the party bus, then they go home and the spread, as you saw in the video. So these things equal lives saved if we engage in those things. So how does it increase economic impact? We have to have a significant, I can't say it enough, significant reduction in our cases. When we have a significant reduction in our cases, our business reopen. That's a plain fact. Then we can get back to normal life. Our schools reopen. Look at our schools. Excuse me. Across the country, there's this debate going on. Should schools open? Should they stay closed? And it is having an educational impact on our children. Let's face it. Because everybody is not have equal access to technology, to learning. And so when we don't reduce the cases, schools are closed, they're doing hybrids, they're doing virtual learning. So it's really important, and that's an economic impact on the long run as well. Sporting events and entertainments reopen. I mean, this is America, that's our livelihood. I saw on TV, I don't remember which team, but it was a basketball team playing basketball, and nobody was in the stands. And then I know in some other country they put these robots to cheer, and so I thought, because nobody was in the stands. And that's an economic impact. Think about all the money that's lost to those workers that go to those stadiums and that serve food, that take the tickets. So that's an economic impact. And that's a congregate setting. So if you have lots of cases, those things stay closed. Hospitals and healthcare resume healthcare treatment. I talked about that earlier. Without our hospitals being overrun with COVID, it's really important that you understand the economic impact this is having on our hospitals. They're doing non-essential services, so you can't go in. Their bread and butter is not COVID. It's other healthcare services and treatments that they provide us. And so that will have a huge economic impact on our hospitals. And then last but not least, healthy employees return to work. We can't have sick employees coming back to work because, again, they infect the ones that are healthy, and then now everybody's out. So again, that's an economic impact when we don't have healthy employees. So this is why contact tracing is important and how it increases our economic impact. So just wanted to share. So now I want to show you the correlation between what's happening now and it really goes with our contact tracing as well. So if I sent all of you the notice that the governor came out and he has a resurgence plan within our Restore Illinois. And as you know, we are in phase 4, and in phase 5, you move to phase 5 only when some metrics are made in addition to having a vaccine. So that means we're going to be in 4 for a long time. And there's this fear about, we will be going back to 3, sheltering in place. So I think this will address some of the concerns we had. When we moved to phases initially, a lot of us, and not just in our community, but other communities, were concerned to be tied with Chicago and the Cook County because of the impact of their size and scope. So what has happened is they've restructured, and now they have 11 regions, and Kane County is only with DuPage County and Region 8. and it's called also the West Suburban Region. And as you can see, we have over 500,000 people, and DuPage has 1 million people. And collectively, that gives us 1.4 million people versus the millions of people when we were with Cook in, with 7 other communities, Chicago, when we were the Northeast region. So these are what our metrics will base on, whether we move up or down and what our community looks like. So I wanted to make sure we understood that, and that's why it's important as a community we keep our numbers down, and so we won't be impacted by Chicago, we won't be impacted by Cook County, but we have to take care of what it takes to keep our community healthy so we can reopen without the impact of others. So actions to combat the resurgence, this is part of the plan. So what could cause us to become more restrictive? And there are ways there's a combination of ways. We have to have a sustained increase in 7-day rolling average, 7 out of 10 in the positivity rate. And that's a combination of DuPage and Keynes. How many positive cases divided by how many cases were given. Okay, so it's really important that we have that number. Again, it reduces our rate because it's just 2 communities, but at the same time, if we're not reducing our positive cases, then that's a problem. So then you take that positivity rate with one of the following: a sustained 7-day increase in hospital admissions for the COVID-like illness, or a reduction in the capacity of surge capacity. And what that means is, the first one is what I said before. You may not be in ICU, but you're taking up a hospital bed, and then that reduces their ability to treat others. Or you are in ICU, and as everybody heard, that's when you're taking up a serious bed and ventilation and all the resources that go with that level of care. So you take that. So those are the things that would cause you, or 3 consecutive days averaging greater than or equal to 8% positivity rate. So these are the things that would make us become more restrictive. And I'll talk about the restriction in a minute, not go back, but restrictive. There's a out of order slide. Could you pull this one? Is the next one, that one. So this one actually goes with what I just talked about. So when you could go on our website or IDPH's website, and this is a really good indicator that you can check every day. It's quick, it's simple, it's colorful, and it gives you the information right away. So when you look, if you hover over Kane County in the map, and then it'll come up with Region 8, and you click it, and so that'll prompt the the website to put Region 8 up there, and then it'll populate every day this information. And so for those of you who are like color coded, as long as we stay in the green, you're great. Those who like details, read the data. And if it says positivity, 7-day rolling average, and when I took this screenshot, we were 4 days. And so you can tell from the data whether we are in good shape or not. And then when you look over, as I talked about in the green, where you have the hospital, where you pick one of the other. So the bed, the medical surgical bed availability is a 20% threshold. And again, as long as we're in the green, we're good. We run down to the pink, we have problems. So then you look at the ICU bed availability. Again, the green says we're in good shape. So on these 2 days, our bed availability was 45%, and our ICU bed availability was 53%. You start dropping below that, then that means there's something terrible going on in the community that we really need to take action to mitigate. Can you go back to that one? Okay, thank you. So I only gave you a snapshot. I didn't give you.
Where was that website at? Was that?
Yeah, it's on the, you can go to IDPH. It's on ours as well, but IDPH. And then look at the resurgence metrics.
Okay.
Yeah.
Thank you.
Mm-hmm. So what does that mean when I initially, how do you become more restrictive? So before, the thought was we'd move back a phase. Well, the state has decided to take a different look. And so one of the things they did, they came up with several settings, and I just gave you a snapshot. There's others on here, but I just kind of want to give you an overview. So if you look at the bars and settings, so you could say, we get our contact tracing, and all the data has to be analyzed. You're like, oh my God, there's a cluster. And we find out all the people who were positive in the last 2 weeks went to this bar or bars in Kane County. And so we have to say, okay, we're not going to shut down the hospitals. We're not going to, reduce their elective surgery. We're going to stick right there with that cluster and say, okay, so do we reduce, what's going on? Do we reduce indoor dining capacity and suspend their indoor bar services? That's tier 1. Or do we suspend indoor dining and bar services? And tier 3 is just suspend in-person dining takeout only. So that gives us a better flexibility in minimizing sheltering in place, shutting everything down, and just really targeting where the problem is. And sometimes that problem might impact 2 or 3 of these settings. We don't know yet. But this is the thought behind the resurgence, and it gives us a better control of relaxing some of the measures when it comes to letting people continue to be out. So again, it's about mitigation, containment, and control. And the mitigation would be, how more restrictive do we make you? And then we would talk to the owners and find out, so what happened? People weren't wearing bars, wearing masks, they weren't social distancing. And then maybe that's part of the education for those owners of those bars and restaurants. So now I just want to give you some data again around Kane County so you'll get a picture of what's happening in our community. So the first graph is around hospitalizations in persons age 60 or younger. So we all know when you're older in nursing homes, 80, 90, you have a higher risk of getting sick and being hospitalized, and with additional comorbidity. So this really shows you the community that's not in long-term care, but that's out in the community. So people are 60 and younger. And so to the left, if you look at the left, 72% of the population of Hispanic and Latino persons in Kane County are hospitalized the most. The next group that has hospitalization due to COVID is the white population, and the next population of 7% are Blacks, and Asian make up 2%. But then when you look at the chart right next to it, 74% of deaths in that age group, persons 60 or younger, are Hispanic and Latinos, but disproportionately, the Blacks make up 7% of hospitalization, but 19% of deaths under 60 and younger. And then the whites make up 7% of deaths in people under 60. Next slide, please. So then we look at the deaths due to race and ethnicity in Kane County. So when we look at the left chart graph, you look at, so you have 2 numbers so you understand what's in there. 55% of the whites have deaths due to COVID-19, and the other number is the actual number, 156. And then the second highest death due to COVID are the Hispanic population. And then the third group are the Blacks at 17%. But when you go over to the left, you compare us to the state of Illinois, the white population makes up 44%, whereas the Hispanic population makes up 21%, but then disproportionately, the Blacks who have in Illinois make up 28% of deaths in the state of Illinois. So what this does is gives you a rate of incident, how the population in Kane County looks. And so the bars you'll see by far our Hispanic population, Hispanic Latino, has the greatest prevalence, incidence of COVID-19 in our population per 100,000. And then followed by the Blacks, then the Asians, and then the whites. So that's what's happening currently in Kane County. Now, this is a chart that we use a lot in our decision making, and this is very important. This is very color coded for a reason. So this is age by distribution of cases in Kane County. So if you go all the way to the left, week 1, you notice the green bar. Just don't read the, no, just go all the way across and look at the green bar. So the green bar represents people between the ages of 50 and 59, and see that first week or so, they had the highest cases, but as you go across the spectrum, their cases reduce. But then let's drop down all the way to that brown bar, and the people in the brown bar have increased their cases, and that's our group of 20 to 29-year-olds. And if you go across, look how they're constantly increasing the number of cases. So you have to ask yourself, what's going on with that group? Are they out in bars? Are they going on vacations? Are they hanging out? And so that gives you a really good idea of where you need to focus your energies on because that's your cluster. Then you go down, let's look at the orange bar. The first 4 weeks, there were none. And now look at that orange bar. That's our 10 to 19-year-olds. That's concerning to us. So we are anticipating, if you see, especially the third week from the end, could that be they're all going to summer camps and these sport camps that started opening and closing? So that gives you an indication as well what's happening. So each one of these bars you can go through and see where are the cases by age, and that'll give you an indication. So what's going on with that age group of people? And that gives us some really good information on how do we decide how we're going to do mitigation, containment, and control. So that's why this is really important to have the data. The data tells it all. Between the data and the science, that's how public health works. Thank you.
Director Jeffers,
Yes.
this is Dr. Silva. Good morning. May I interrupt you for a few seconds? Thank you. I think it's really important to point out and to basically call out some misconceptions in some of the high COVID populations and in the 2 high COVID populations, the incidents. One of the misconceptions I think has to do with the fact that there is a lack of knowledge or a lack of an ability to wash hands. And really, I think, and research does show that the Black American and Latino population is really out there providing essential services. So we're the ones that are out there working. We're the essential workers. So because we're a lot of times we haven't had traditionally the ability to build generational wealth or to establish resources throughout generations for a variety of factors. We can go way back in history regarding that. But because of those things, we see a lot of essential workers in these 2 communities. So it's not simply a matter of putting soap and water in front of them so that they can wash their hands. Trust me, the populations know how to wash their hands. It's more of a socioeconomic issue. And I invite my fellow board members to really do the research, because it's not up to these populations to educate us. It's up to us to educate ourselves regarding these racial disparities. Thank you.
Thank you, Dr. Silver, and you're absolutely right. That's part of what I call mitigation. When you talk about an essential worker, you're absolutely right. One of the things we saw when we talk about clusters of positive cases was in our food plants, our food manufacturing plants, and that's where we had a huge population of minorities, and the food plant wasn't engaged in the mitigations that were important from social distancing, mask wearing, and those mitigation things that will help keep us safe. And so you're absolutely right, is when they go to work where they're getting the cases and not necessarily washing their hands, but their employer's not giving them the proper mitigations to keep themselves safe. So you're absolutely right, I would agree. And when you're an essential worker, you are the largest impact. So we do have that. We are aware of that. So thanks for pointing that out.
Thank you.
Again, that will help us look at, is what she said, what is going on with this group of people. And so we don't just use the age, we also use the ethnicity to see where people are going. So our next step is next week, we will work with our vendor to initiate the contact tracing. That same week, they'll start the recruitment of contact tracers. The Illinois Department of Public Health has decided that Kane County will launch its rollout of Salesforce on July 30th. That's a hard date for us. Then the onboarding of contact tracing will start. We will, once we get going, I will be providing the Illinois Department of Public Health, the Kane County Board members, as well as the Kane County Health Advisory Board reports regularly to keep you abreast of what's going on and answer any questions you may have or concerns or some things that you might spot that we don't see as well. And last, as I talked about earlier, I put the link there for our community if they're interested in contact tracing to sign up. This is the link to the state of Illinois' website. And what they do is on a regular basis, we have over, what are we up to, Michael, 700? Right now, we have 700, how many? Almost 800 people who have signed up so far. And so what we will do is give that list of names to our vendor to begin to contact them on contract tracing, and they'll do the onboarding, screening and interviewing and those kinds of things. So that's how we're approaching that. So that, as I told you last month, I wanted to talk about contact tracing today, and that gives the overview of what it is and the impact it has and the steps that the health department is taking and will be taking in the future.
Okay, thank you very much. That was a lot of really good information. Any questions in the room? Mr. Hanson?
Good morning, and thank you. Thanks, Barb. When it comes to the reporting, will that be a function that our vendor will be doing, or will they be reporting to you and you slot it into the reports for the county that go to the state? What's their role in the actual reporting of
Yes,
what they
they
find?
have to create the reports and get them to us, but we will have regular meetings as well. That's why we're going to have a technical consultant that works just for us, thanks to Roger, to help us. So, when this is not your line of work, you may not understand some of the language they use and what that means. So that's why we need someone to help us on our side to do that. So when the reports come in and we have meeting, we can begin to question some of the issues that we might see as issues.
Thank you. The other question I've got is, we always want the best people to perform the services that we compensate them for, and it'd be great if they all came from Kane County. Hopefully there isn't some energy and some effort to hiring folks within the county. But if they come from outside of the county, that's okay too. For the community colleges that have a contact tracing program, where are they and how long does it take for someone to complete a program that's offered through those community colleges? And would they be at the, I don't want to drive any sort of recruitment effort, but will they be completing their courses or their qualifications, their accreditations in time to be a part of this?
Well, we've sent out messages and asking our community to sign up. And while Benzie was, really on the forefront in Elgin Community College as well, creating those programs. So, because some people didn't have a clue what contact tracing was about. So that's a good thing. Even John Hopkins had a free course. However, as late as last week or week before, the state came out and they have a specific ASTO training that we are required now to all of our tracers to participate in, because I think they want a standard of all tracers for Illinois. So I think what will happen is if you took the Wabanzi course, the ASTO course would be a lot easier for you to go through because you've already been through an overview. So I think it's still important, if you want to do contact tracing, to continue to, all of my staff have, not all, but most of my staff have gone through the Wabanzi training to get their contact tracing, because we have to be oriented to not everybody's a contact tracer in the health department, but you need that information to make some good decisions.
Thank you.
Mr. Weber?
Thank you. I would be really interested to see a current SOP that the health department uses for contact tracing, as far as, how they, so Steve Weber tests positive. Can you walk me through what happens?
Mhm.
Could you?
I will.
Thank you.
So what happens is you go to a test site, be it your doctor or one of the state-run sites or wherever you get tested. And then that test goes into to a lab who determines if you're positive or negative. If you're positive, that positive report with your contact information goes to the state of Illinois IDPH in a system called INANS. And so every hour, employees check that website. And so then you get all the positives, and within 24 hours, somebody calls you up. And what that starts is not contact, it's called case investigation. So, because you're the case, because you tested positive. So then they call you up, and there's a series of questions they begin to ask you to begin to jog your memory of where you've been. And one of the things that contact tracers has to be good at is knowing how to do so let's say you say, we say, so Steve, where were you yesterday? And you say, I went to the park. And so most people are okay. And they say, well, what did you do at the park? And you say, I sat on the bench and had lunch. And you say, was somebody sitting next to you? And he's like, yeah, one of my neighbors. And then how close were you? Did you have on a mask? And so then we would need to get all the individuals within a certain period of time when you became symptomatic or not, and get those person's information and their contact. So your case investigation. So now the contact investigation starts. So let's say you and I had a 15-minute conversation without mask. So now they call me. They won't say, Steve Weber exposed you to COVID. They say, you have been a person who may have been exposed to COVID-19. And then they go through with you. First, they ask you about your symptoms. And then if you're not symptomatic, then they tell you, when you go to case investigation, then they tell you about your isolation, how you have to stay isolation and all of that. So then they get your contacts. And then, so let's say I was a contact. Then they would call me and say I was exposed. I may have been potentially exposed to the virus. And then they give me all the steps I have to do. And then if I'm symptomatic, that triggers something else. And then they will advise you to get a test. Everybody doesn't want a test. And if you don't test, you stay home at least minimum 14 days or until your symptoms start. And if your symptoms start, then that period starts over from that point. So that's basically how it works.
So you call me and I said, I don't want to talk to you. What happens then?
That's part of the reporting. They'll tell us all the people who won't talk. See, that was part of our scope of work because that's important. A lot of people aren't going to talk to us.
Right.
So that's why it's important. One of the things I want to do with the CARES money is get a marketing plan out because people have to understand the importance of this. And if you don't know, and if you're going on with your own bad information, you're going to go with that. You go with what you know. And so we will have a list of all the people who don't adhere to the guidance. I'm going to tell you something. If people know you're positive, they will call us. We got a call once from one of the police stations and said, the community is reporting John Q is out. We know he's positive and he's out walking around. And so they went and picked him up and found out he wasn't walking around. He was headed to a medical appointment. So you see what I mean? We try to track you. If you don't return our calls, that's a problem. But remember, once you are in that database, we have your number. We know where you are. So you don't have to talk to us. We can send you some literature on what you should do and what you should maintain your social distancing. The other thing we offer a lot of our community members is a letter to their employer just saying they have to be isolated. We don't get into their health care, that they have to be isolated for 14 days because some people need notes for work. And then we also provide a letter saying you're safe to come back to work because people are afraid of employees coming back to work as well. They may not be, infectious. So we also will provide you a note, say yes, if you want one, that you are no longer infectious.
Okay,
Does that help? Yeah.
No, absolutely. I try to think how intrusive this, can be as far as like people's privacy and stuff like that. So I'm just asking these questions. In regards to Salesforce, that's a phenomenal ERP system that as far as reporting, obviously you'll be able to go in and you can dial down exactly what you want to see with Salesforce. It's a huge,
Thank you for
huge
that.
program. Yeah, yeah.
Thank you for that, because
Yeah.
again, we were out of our element, so we started calling, this is why it took us so long to figure out who would be best to work with us. And that's what Roger said, you have to have somebody who knows Salesforce, and if they know how to work with Salesforce, it'll be an easy transition. They don't have to get up and running, and they're ready to go and not have to have that learning curve.
So that's
thank
a
you.
very good program.
Thank you.
Well, I think also to Mr. Hansen's point, it's important that we hire people in our community to do these jobs, because you're more likely to talk to somebody who is in your community and somebody that you trust. So it's important that we have a good demographic of people from our community that we hire. And I just have a quick question about that. So the company I work for, we have not had a case. I'm so proud. But our management has gone through contact tracing. So if we would have a case and we are like instantly, like as soon as we know we have a case, or we even send somebody home because they have a temperature, at what point would you guys come alongside of our company to help us, like we're going to instantly get our frontline employees and we're going to instantly start interviewing people, but where do you fit in with us?
Well, one of the things we encourage our community, and we do, it's well done with some segments of our population, others not so well. I know internally, the sheriff, the chief judge, we have certain departments we do really well with, and then some community leaders. So remember how I said how the process works. You got to get a test, you get positive. But if as an employer, if you know a person's positive, the most effective thing to do is to call the health department right away. So we won't wait till that case shows up. We start it right away. And we have done that here because remember, we don't have enough contact tracers. So when I get a call, especially if there's a huge cluster of people in congregate settings, we put you in the front because we know you have the potential of affecting several groups of people quickly. So it would be best to call the health department to start the process, and we give you some feedback on what happened. I want to give a shout out to the chief judge. They institute a great program that helped us tremendously. So when you go into court, you have to sign a statement. So I know everybody who was in court. So if they had somebody come in, they were positive, we got the list already. I don't have to call him to ask him, so who did you stand next to and who did you talk to? And so if you were there, we would call you up and say, you may have been potentially exposed. This is what you need to do. So calling us up and coming up with some systems would be real helpful to be more efficient in getting people the information quicker.
We have Mr. Caius on the phone who has a question.
Good morning. Can you hear me?
Morning. Yes, we can.
Oh, great. Thank you. Well, Mr. Weber asked part of my question, but this is a question for Director Jeffers. Is there a definition of what a contact is, like a minimum contact? I thought I had read something like without a mask within 6 feet for 5 minutes or something like that. Is there some sort of a specific definition?
That's not a contact. What you're talking about is exposure. So if you've been exposed according to the guidance, and I will do this caveat every time, the guidance changes all the time. But our current guidance is that if you have been in contact with someone less than 6 feet for more than 15 minutes, you are considered to be exposed.
Oops, okay. Great. Thank you.
Mr. Sanchez.
Thank you, Madam Chairman. My question revolves around the Latino or Latinx population. We're seeing a lot of numbers per 100,000. And one of the issues revolving around that community is the issue of illegal immigration and the presence of illegal immigrants. And some would say we shouldn't do anything for them, but obviously we have to test everyone, no matter what their status is. I imagine some of the reason we're seeing such high numbers in that population is because of the presence of illegal immigrants that don't want to maybe even get tested because they feel like they're going to be threatened. Can you speak to that in any way? Should they be worried that their immigration status is going to be leaked to other agencies and somebody's going to be coming to knock on their door for contact tracing and deportation?
Well, first and foremost, no one will knock on the door to do contact tracing. That's one of the reasons we have to do a huge marketing campaign. What contact tracing is, and what it isn't, okay? If somebody shows up at your door, it's not contact tracing. Simple as that. Can I speak to that? I'm not the federal government, so I can't speak to anything relative to ISIS and things. I hope not. I think it's important that we don't share information with any other agency other than IDPH, because again, public health's primary role is to stop the spread of this virus, not to get into any of the other issues that may be around. That's not something we're going to engage in.
Director Jeffers, this is Dr. Silva, I'd like to add something to that, if you don't mind.
No, go ahead.
The news media and the Spanish-speaking networks have done a phenomenal job of educating the population that they service. And so you have a lot of, in social media, on TV, on the radio, you have a lot of public service announcements regarding this issue. I would actually say that, you know, there has to be some fear at any point of being accosted and being removed from your residence. However, I would say that again, the media has done a really good job of public service campaigns, excuse me, and directing people to where they need to go, and to not be afraid of getting tested. So I don't sense a general fear in the community. I think we have bigger problems with the misconceptions that are out there locally. I think I've heard things from people they're charging for the test, or they used to charge for the test, or the lines are really long. I will share that a member of my family was tested, and he was told that he would receive results in 7 to 10 days, and he is not. It's been almost 2 weeks, and he has not received any results. So I think our problems have more to do with the logistics and the issues involving maybe some misconceptions. So I think the public service campaign that you spoke about which you spoke, really rang true to me. I think that's so important, because we do need to clear up some of these misconceptions that I think are doing a far more disservice than maybe some of the federal issues. While that is an important point, and we have to convey that well, I would really like to convey with some sort of certainty that won't happen. But I think, again, some of these other issues that people might think that, oh, they're charging, or it takes too long, or I'm not getting my results. I'm you know, what am I going to do if I'm not working? So these are issues that that definitely can be dealt with, and I think are just far more prevalent, at least from what I've seen in the circles that I run in. Thank you.
Dr. Silva, that's why it's important, again, that we have our vendors do the contact tracing, so we as the health department can reach out to our community to reinforce the importance of who is doing this and why it's done. A contract tracer on the phone will not be effective as if we look at our leaders in our community who are influencers to help us to educate our community on what should be and what shouldn't be. And that's where we would draw on you and the various other leaders in our community to help us help our communities. If we're on the phone doing contact tracing, we can't do that. So that's why we want to do a huge marketing campaign, but we can't do it without you, because if we don't have trust in the community, it is not going to happen. And as Steve said, he's not of that population, but he just may not answer the phone. So we really want to work with our community locally to find out what are the concerns of our community and how do we minimize those concerns. And that's where we will base our marketing campaign and outreach on to get people to engage in responding quickly.
Happy to help. Thank you.
Thank you.
All right. We need to move along because we have 2 resolutions and we have animal control, and we also will have to have executive session today. So I'm very sorry to the legislative committee, who's also here for this committee, so,
We're going to have a long executive too, so.
yeah.
I'm just kidding.
Well, good, as it should be. All right, is there anything else you needed to add before we go to resolutions? Okay, we have 2 resolutions. The first one is authorize and entering into grant agreements. I need a motion and a second. Ms. Allen, Mr. Kenyon. And basically, I'm sure you all read this, but it's basically kind of an overview saying that we have a lot of grants coming in. And it's saying instead of waiting to go through all this process, we're going to accept the grants because we need to get it moving.
It
There's
it
not-
expedites the signature.
Yes,
These are the ones we typically get. We know we're going to get in a year, and sometimes the state says if you don't get this back within 20 days, 30 days, they won't give us the funding. And as you know, the health department is 45% grant funded, and we really rely on our grant funding.
so it's quite a logical thing. Any questions? Okay, all in favor? Roll call. Clerk, call the roll. Sorry.
Silva,
Aye.
Allen, Kenyon, Sanchez,
Yes.
Thomas, Weber,
Yes.
Lewis,
Yes.
Thomas,
Off camera, share my screen, and then we'll,
Okay, it passes. All right, second resolution, authorizing an approval of the 2021 MAPP Kane County Community Health Assessment and identified priority areas for the 2022-2025 Community Health Improvement Plan. I need a motion and a second. Mr. Sanchez, Mr. Weber, do you have a quick comment on this?
This is part of our certification to be a state certified health department through IDPH. And what we've done successfully is to work with our partners to help fund this endeavor because it's very expensive. So we're working with our 5 hospitals and our Inc. board to help support the community health assessment, as well as fund the assessments that needs to be taken in the community.
Any questions, Ms. Allen? Go ahead.
I can remember when Barb first was talking about this, maybe the last cycle or whatever. The trick is that everybody needs to do this assessment. And Barb figured out that if everybody came together to help pay for it, that you could get this done in a much more expeditious, more cost-effective, and a larger overview by virtue of working together. And it's just one of the things that Director Jeffers is so good at, is building these communities within our community. I just want to say thanks, because you just keep doing it so well. Thank you.
Okay. Any other questions? Okay, clerk, call the roll.
Silva,
Yes.
Allen,
Aye.
Kenyon,
Yes.
Sanchez,
Yes.
Weber,
Yes.
Thomas, Lewis.
Yes.
Passes.
Okay, passes. Thank you very much. Before we finish with you, I want to also give a shout out to you. I was at a school board presentation for East Aurora District 131 Monday night, and they rolled out their whole plan for going back to school. And there was concerns about, well, are we working with the public health department? You know, are our kids, are we going to have outbreaks, all this? And they said, oh, Barb Jeffers has been very good at working with the regional board and with the individual schools about making sure that we have all the proper protocols. So I was proud. So thank you very much. Another area that I don't think sometimes we understand how much you and your group are affecting every area in our community. So thank you very much. Moving on to animal control. Are you still there? Poor Brett. He is. He's muted.
Brett, if you're still with us, you may need to press *6 on your phone to unmute, but we need you to unmute.
Can you hear me? How about now?
Yes, now we can. Thank
All
you.
right. Good afternoon, everyone. How are you?
Good morning still.
Oh, good morning. Sorry. One of the big things for us to discuss today is my expenses are still over my revenue. If we flip to that page, I'm sorry. Roger, if you can scroll down just a little bit. Part of that, what's hitting me is I'm still estimated at about an $85,000 loss on this year, and that's due to people aren't going to the vet. Vets are trying their best to reopen. We just held a large vaccine clinic I'll get into in a minute. But people are still afraid to go out. And with the numbers going back up, we don't know what's going to happen because you have a lot of people just afraid to travel out right now. So the other thing affecting us is if anybody's ever been to our facility, you'll notice we have a very nice open area when you walk in. Well, that has had to be modified. So we've had to add glass partitions to the whole front. We've had to modify our lobby. We're changing our locks on our doors to kind of lock down the front, and that's, of course, affecting us cost-wise. So we're kind of getting a double whammy of having to put money into the building at the moment when we're trying to save money, and at the same time, not bringing in the funds we normally do. The good news, though, is starting in April, we had about a 40.35% loss. It dropped down to a 35.69 in May, 25.49 in June, and in July, we're estimating a 22% loss. So the good news is our percent loss is going down. We just don't know where it's going to stabilize on the year. And that leads us to what we're trying to do to help that situation. We held our first mobile vaccine clinic of the year. I'm proud to say 3 weeks out, not one person has gotten sick or reported sick through contact tracing, thank you. So we're very happy to say clearly we did it right. Our protocols were followed very tightly with wearing masks, isolation, not allowing people out of the vehicles, and we really ran very smoothly. We started about 8:30 in the morning, it ran till 3 o'clock, normally do a 10 to 1. We serviced 134 dogs, 30 cats, which is one of the largest clinics we've ever run. People waited in line about 2 hours. We did our best to dispense water to the people, to the animals, ensure that people understood that we were doing our best to move through. We almost ran out of vaccine. That's how busy it was. We're very excited we were able to service the community in that way, though. We do have another one coming up August 25th. Sorry, I'm getting you the exact date right now. That's August 22nd. August 22nd, 10 to 1. We will, of course, probably be starting early because we like to get people right when they get in line. A little back up onto Kessinger Road, but we did our best and really maintained it very well. So we're very proud that we were able to do that and help service the community through such a wonderful service. That's all I had for you this month. Does anybody have any questions for me?
No questions, but thank you very much for doing that. Those clinics are very important.
Of course,
Mr.
thank
Weber
you.
has a question. Okay, Mr. Weber has a
Brett,
question.
I'm sorry, I do have one question. Can you do the clinics more frequently if it was such a long wait? If you did it more frequently, it wouldn't, because obviously if people aren't able to get to their vet, they need an avenue to be able to get, the vaccinations and stuff like that.
Of course. We do have the next one coming up on the 22nd. We're going to base off of that. July, we just take our break because of the heat. So we try to get through a bridge month. And then August 22nd, we're going to reassess. And then we do have 2 more for the year, but decide if another Saturday or 2 Saturdays should be thrown on. We agree with you 100%. We had actually people drive by and go, oh my God, what's going on here? So that was fantastic. We had calls for about a week asking us why we were so busy at our facility. So yes, we will be reassessing that. We'd like to do it in the cooler months. So we're going to look more to September, October to probably add those on, just because it won't be as high heat because it was a little warm in the June one. August, we're reassessing how we can maybe make it a little bit cooler for the animals. And then from there, we'll redecide in the cooler months how to add more on. But yes, I agree with you 100%.
Thank you.
Okay, good question. All right, no questions on the phone? Okay, good. All right, thank you very much, Brett.
Thank you.
Okay, we have no old business. I do need a motion to replace the reports on file. Mr. Weber, Ms. Allen, all in favor, say aye.
Roll call.
Roll call for this
Everything
too?
roll call.
Sorry, everything's a roll
For
call, that's
adjournment.
right, because we're in the new world.
Silva,
Aye.
Allen,
Aye.
Kenyon, Sanchez,
Yes.
Thomas, Weber,
Yes.
Lewis.
Yes. Okay, we do need to have an executive session? Yes, I need a motion to go into executive session. Pardon? I move we go into it. Okay, and Mr. Sanchez wants to second?
Sure.
Thank you. Executive session to discuss a personnel issue?
Later, Mike.
We have to do a roll call? No. We have to-
Silva, Allen,
Aye.
Silva, here.
Kenyon, Sanchez,
Here.
Yes.
Or yes.
Lewis.
Yes.
We're live.
So we're back in open session.
Just saying that it's an
Now we
official.
can have a motion to adjourn? Adjourn?
I'll
Thank you.
second.
Mr. Weber seconds.
All in favor?
All in favor. We don't have to do a motion on this one.
Aye.
So adjourned. Thank you very much.